the governor of Rivers State blowing hot, on those who are guilty of, failing this, activity, causing a monumental disaster, really, on our health, as a people. Now, we have in the studio to help us give perspectives to these discussions, a public health expert, and we are talking about Agbo Ebuta. He joins us in the studio to give us perspective. Dr. Agbo Ebuta, thank you for joining us on the show this morning.
Thank you for inviting me.
Yes. I'm sure you have an experience, with what we are talking about, this Soot thing. Maybe if you may, in your experience, how, at any point in your life where you have to, deal with this.
Well, I'm from the Niger Delta, and I grew up in the Niger Delta. And even if I have spent a significant part of my working life in the federal capital, I would say that I am still in touch with what is happening in the Niger Delta. And only recently, I think last month, I had the pleasure of visiting both Rivers State and Bayelsa State, Yenagoa and PORTHARCOURT. And I came in touch, direct contact with some of these menace that we are talking about, the black soot. It is even considered that even the blind can see black soot in PORTHARCOURT. The deaf can also hear black soot landing on the skin in PORTHARCOURT. That is how bad the situation is. And for the government to come out very recently to fight it in a very robust way is definitely a welcome thing. On a personal level, I have relatives in PORTHARCOURT who complain of this menace, the health implication on them, and they have clear health complaints that we can tie to that. Only recently, a friend of mine who is a colleague working in Lagos had the unfortunate pleasure of having to evacuate her father, who was suffering from a serious respiratory problem in PORTHARCOURT, a 70-something-year-old man with a respiratory problem. Even his age reduces his respiratory reserve, how much more he stays in an environment that is filled with soot and smoke. We all know what the health implications of cigarette smoking is. So imagine that at all points in time, 7-8 million people in, let us take Rivers State for example, 7-8 million people in Rivers State are smoking morning, afternoon, or evening. You all know what I mean. It's also passive or second-hand or secondary smoking. It has a lot of names you can use. For example, if you were to drive home the point, if you are not a smoker and you stay in a room, you go to maybe a club where people are smoking and you stay there for 1 hour, you may have smoked within that 1 hour between 10 to 20 sticks of cigarettes. That's what passive or secondary or second-hand smoking does. So imagine you are doing that at a large scale, a public health scale. 8 million people, all ages, are smoking or inhaling black soot. And black soot is a little complicated. Black soot is the particular black soot that is obtainable. We know most of the activities that generate this type of black soot. There's basically hydrocarbon. Hydrocarbon is oil that is gotten from, you get underground sources and all of that. This oil is not just strictly hydrocarbon. It contains other chemicals. It contains chemicals like arsenic. It contains chemicals like chromium. It contains chemicals like cadmium. All these chemicals are established causes of health challenges, from cancer to inflammation to all sorts of things. So imagine people are inhaling soots, and this soot contains these chemicals. So in addition to the chemical effect of the soot, you have the particulate impact on the respiratory system. So you have people inhaling the soot, and these particles are being deposited all the way in their airway. In fact, many years ago, when the United Kingdom had a very thriving coal industry, there was similar challenges in the coal workers. In fact, there was something called the coal, it's still there in some areas, the coal worker pneumoconiosis. Pardon the language, it's just for completeness. It just means that the coal worker has a health problem due to the accumulation of particulate matters derived from coal in his lungs. If you see the lung of a smoker, the lung of somebody who is exposed to black soot may be worse. So you have particulate matters deposited, and these particulate matters cannot be dissolved. So once they get into the airway, they stay there and they are permanent. And they start initiating several activities in the lungs because they contain chemicals that we talked about. And these chemicals are foreign. The body now tries to fight those chemicals and get them out of the way. That's how your body responds to all infection, malaria, whatever. You try to fight it and get it out, but they cannot. So the person tries to cough it out and develops a chronic cough, for example. We call it bronchitis. If it stays for too long, for 3 months to 2 years, and all of that persistently for 2 years, we call it chronic bronchitis. I can tell you for free that in Rivers State, you have a high case of people with respiratory problems. That is just one aspect. Apart from the particulate nature, you have the inflammatory effect, as we talked about, in the lungs. Now, that inflammatory effect on the lungs results in the continuous release of chemicals that are involved in fighting foreign bodies. Now, these chemicals, under normal circumstances, when you clear the foreign bodies, right, they go back and they relax. But they are consistently agitated because these particles cannot be cleared. So these chemicals are persistently released to all parts of the body, and the person is experiencing a chronic inflammatory process. So the person is persistently exposed to oxidative stress and inflammatory stress. And if we want to talk about the effect, it affects all systems in the body, and I think in the course of our discussion, we'll throw more light.
Okay, now, do face masks work against, inhaling this soot? Because I know a lot of people who have complained that even after cleaning their houses, locking their windows, not even going out, they still find particles of this soot within.
Good. Face masks, the particles come in different sizes. Wow. They are very tiny sizes. They're little bigger sizes, and there are other sizes. There are sizes that would just stay afloat. Now, there are particular sizes of particulate matter that cannot cross the nostrils. Okay. They are trapped in the nostrils. Some, because of size, are trapped in the upper airway. But some, because they are tiny, they are minute, they go all the way down to the airway. In all sincerity, the face masks may ameliorate partially, but it's not a solution. The kind of masks that are specific for protection of the airway, it's very clear on that. They are the N95 masks. Okay. These are N95, N99, because that is the percentage of filtration they do. And it's not even 100%. 95, 99. That tells you that the percentage of filtration is not 100%. So yes, those are the kind. These masks are not they are not cheap.
In any case,
you don't just go and buy them.
In any case, are you even going to be wearing the mask all
the time?
And what about children as well?
That is the thing. So that is it. Our major population is children. Most of we have one of the youngest population in the world, so to speak, because more than 60%, actually more than 90% of our population are less than 65 years old. You don't have that in a lot of countries. Japan, for example, has 40% of their population more than 60 years old. So that tells you there's a lot of, so we have a lot of young people. So that means that these people are going to experience this exposure, and for the rest of their life, for the remaining part of their life, they would continue to experience either some level of reduction in health efficiency as a result of the chronic effect of these deposits. So this happens, and it affects all parts of the body. For example, I would say that the most important place it affects, obviously, is the respiratory system, because you breathe it in and all of that. So we have high cases of bronchitis. We have high cases of asthma. Even people who have a family history of asthma are more likely to develop the asthma. Even when they develop it, the asthma symptoms, signs are more likely to be more severe. There are more frequent attacks than the usual. And apart from that, they are more likely to have respiratory infections. And I was looking at certain data recently, and it will surprise you to know. And I cannot say it is not unrelated. The River State population, River State is probably around 8 million thereabout. By extrapolation, in 2016, it was probably 7 million. Probably are looking at 8 million now. That is the 6th most populous state in our country. But if you look at the data from NCDC, River State, in terms of burden and contribution to COVID cases, which is a respiratory problem, is number 3. In fact, at that point, we may say that there may be a correlation between this number of cases, if people who get COVID and suffer from COVID infections, and their respiratory health. And we know that everybody in River State, irrespective of your social status, you are experiencing some exposure to soot. Your respiratory system is being compromised. So maybe that is why we are having more COVID cases in River State comparatively, because we should expect that there should maybe be number 5 or number 6 for COVID cases because their population is like that. But they are number 3. They are only behind the FCT and Lagos. So that tells us that is the black soot contributing to higher COVID cases in River State. Despite, yeah.
Okay, well, what are some of the other illnesses that could be, tied to this black soot, that we know?
There are countless, and in all sincerity, I do not think we know all the illnesses. But the common ones, definitely, that we have evidence to support, is that we have higher cancer cases from the Niger Delta. Because like we said, the black soot from the hydrocarbon black soot and other black soot, mainly that contains chemicals that are established causes of cancer.
Okay.
So cancer cases, definitely. Lung cancer, all forms of cancer, but commonly, mostly lung cancer is much higher. And then, sorry, let me interject immediately. Even for the reproductive capacity in the Niger Delta, patients who are exposed to this, I would tell you that the fertility level is significantly affected. Even when they are able to achieve pregnancy, the pregnancy fecundity, that is their fertility, their soft fertility. And even when they get pregnant, the chances of a miscarriage is higher. If there is no miscarriage, the chances of a stillbirth is higher. If no stillbirth and the child is delivered, the chances that that child would have a deformity is higher. If the child does not have a deformity, the chances that the child will develop with slow, affected developmental statures and is higher. If the child is not affected, the chances that the child will have asthma and respiratory infection is higher. If the child now, by the grace of God, survives all of this, the chances that the child would have cancer is higher. Diabetes is higher. Because there's something. That chronic inflammation has been said to be called what we call endocrine disruptor chemicals. I will explain it. Endocrine has to do with your metabolism, your hormone system, the function. There are many hormones in the body. So what it does is that those chemicals disrupt the function of the hormones. So your metabolism is disrupted. So your risk of diabetes is higher because the insulin function and all of that are kind of distorted. So diabetes is likely going to be higher. And I can tell you for free that the cases, the increased cases of diabetes more in the Niger Delta, in that area, is not unconnected with exposure to hydrocarbon soot that increases oxidative stress, causes inflammation, increases abnormal enzymes in the body, chemicals in the body, and inflammation in the body, and increases your risk. So, I mean, everything is on the table.
Okay, well, you've actually answered, some of the questions I wanted to ask, talking about other diseases and all that. But then, if, for example, today, the federal government, succeeds in stopping, the black soot from, air pollution and everything.
Yeah.
What happens? Does it mean that the residents are safe? What about, the black soot that they've been inhaling all the while? Won't it have an effect?
That is a topical question. It's a brilliant question. They are not safe yet. They are safer because the insult has been arrested, but they are not safe yet. As you pointed out, the body is unable to evacuate the black soot because it stays there. The chronic inflammation will be persistent, and there are risk of developing cancer later. I have a colleague, he got back from the United States, and he was asked to do NYSC. By the time he arrived, he had been in the United States for 21 days. He was free of any symptom of asthma. He used to have asthma. He migrated, he did well. He was in Florida and Texas and all that. And he now arrives in River State, PORTHARCOURT, Nigeria for NYSC. Within 3 weeks, he started coughing. Within 4 weeks, most of his asthma symptoms returned.
Oh, yes.
He was amazed, he was astonished. And before, God knows, his use of medication, inhaler, and all of that increased. Nobody told him that it was from the weather. Acidic rain, soot, and all of that. The guy ran for his life, relocated to Abuja, and guess what?
He's doing better.
Symptoms
Clear.
resolved. Now, you do not need a doctor. You do not need a PhD, a medical. You don't need, that is common sense. You can do the connections together. And that is the story of a lot of people.
Some do not have the opportunity to actually really...
Absolutely.
Yeah.
Some would consult traditional healers who would make local treatment, all kinds of concoctions. Some will blame their relatives for spiritual attack. All kinds of scenarios will play out. And apart from that, the increase in health needs in a population of poor people who do not have health insurance. That implication is also something else. I mean, it cuts the man hours, your ability to function, your quality of life, puts pressure on the healthcare system. Imagine that we didn't have COVID, for example. We would not have the pressure on the healthcare system. Imagine that we didn't have black soot. I guarantee you that we would have less pressure on the healthcare system in the Niger Delta, in the River State, and in Bayelsa, which is relatively affected too. So these are critical health issues. Going forward, what do they need to do? Now that you have established clearly that yes, we have established that yes, even when we stop this black soot, the long-term implications, the short, medium to long-term health implications will persist. Our responsibility will be how to ameliorate it. In ameliorating it, let us look at it step by step. Let us look at cancer, for example. How do we prevent these brothers and sisters, these cousins and mothers, these nephews and nieces of ours from developing cancer later in life? We need to remember I talked about those particles containing chemicals that create stress on the system, oxidative stress and inflammation. So we need to antagonize that. We need to block that oxidation. So what do we use? We use antioxidants. Antioxidants are available in fresh foods. Unfortunately, we are now moving towards westernized diets and all of that. All our diets are basically westernized. But what are the oxidative diets? Things like fruits, vegetables, and all of that. I mean, the mangrove forest, the vegetation in the south can support the growth of fruits, and also we will encourage our brothers there to adjust their diet for rich antioxidants. We will encourage them to also adjust their diet for what we call polyunsaturated fatty acid. Now, polyunsaturated fatty acid have a significant protective effect and all that. So it's critical that they know that your lifestyle has to also change to help you. Exercise, weight optimization, healthy diets, fruits and vegetables. And in addition to that, people should learn to go for a checkup. We have a culture of, in fact, in Nigeria, I think we are 200 million people, and we probably have 35,000 doctors, plus or minus, and we have that's a significant number of nurses and health workers. But I think that in true sense, we probably have 50 million doctors. Because if you have headache now, you may just turn, if you tell your colleague or your friend, in the office, I'm feeling headache. You say, oh no, take paracetamol. Okay, no, I had headache one time, I took ibuprofen. Can you take ibuprofen? Oh, it must be malaria. You sure you don't have malaria? Can you take? So we have 50 million doctors prescribing, but we have a few certified doctors. So if you are not feeling fine, go and see a certified doctor. Get some health advice. It may add something, but it will take nothing from you. Another thing is also, I think the River State, the government generally should look at strengthening the health insurance system so that we can pull in more funds from multiple people and support the few people who would fall ill. Because I can tell you that some of the implications of respiratory infections like chronic bronchitis, you know what it does? You just keep coughing. You cough forever. Like you cough, you are probably 50 years and you start coughing till you're 70. It's debilitating. You go to a place that is dusty, you start coughing, you cough up black soot. Some people in actually cough black soot. If you have friends, you put a call now, they will tell you that I'm coughing black soot. So you need to have a health system that supports these people and give them some sense of, that is one. Number two is that when it comes to at the public health level, for those young children, we need to be able to give them protective interventions, all their immunization, healthy diets, and over time their healing process, their healing is better. If you are younger, your healing, your capacity for healing is much better. And then we also need to put the measures in place so that never again, again.
Yeah, I'm talking about these measures, would you say that we are matching our responses with the danger, that this poses actually? Because I don't know if before this, the governor of Wike and the administration of Nyesom Wike in River State, whether or not we've had, previous administration that have really taken this seriously.
Well, we must say that this is non-medical, but we must say that the bunkering industry, the artisanal procession of hydrocarbon, that industry is a very informal industry. That industry raises a lot of money that is not in the mainstream, and that industry is only second maybe to government in putting money in private funds of people. A lot of the people who are involved in this activity are millionaires. They have a lot of money. They have a lot of influence. They are involved in government in one form or another. So it is difficult to say whether we may be able to achieve. There have been several task forces, to the best of my knowledge. Not now. I mean, there have been many task forces dating back. That kind of activity is just that it went out of proportion. That has been on for decades, I must tell you. It's been on for decades. It's just that maybe due to economic dynamics, or poor control of security controls and all of that, a change in the dynamics, in the people involved in the business blew out of proportion, and the severity of the black soot increased, and even the rich started to cry, and then they decided that they had to do something. I think that is the truth. So whether there has been effort in the past, yes, there have been effort. Whether this particular effort by the governor is going to yield results sustainably. We don't want a quick fix. You do this and then tomorrow elections or something are coming, you have to relax it because the boys need to do some refining to create some incentive and all of that. So we need a sustainable, and that requires that we need to do significant advocacy, sustainable advocacy at all levels, community leaders, traditional leaders, and even the government, the people who take decisions, and the security people. Because if you are a security man and you're trying to ensure that the rule of law stands, and you do not have principles, you can be easily compromised. We know that these people generate significant amount of funds and will do everything to compromise the stakeholders. So these are the problems. But it's good to understand that if we educate some of these people, like these things you are doing, you're also endangering yourself. Some of the clips we saw over there, the guys who were even at the site, like you pointed out, were not even using safety marks and all of that. So they need to be educated that you are doing this, you are generating money, but your health is also at risk. when you need to treat yourself for lung cancer, this money is not going to make any huge difference. I mean, it's not. So there have been effort.
Okay. All right. Well, thank you so much. We would have to end the discussion here.
Okay.
Because of our time. We appreciate you coming on the program today.
Thank you for having me.